Hello, this is Chris from the Obstacle Doc, and we are going to look at calf strength progressions from double leg to single leg. We're going to look at technique as much as also looking at standards for performance so that you know whether or not you're getting to where you need to get to. This can be very important for lots of reasons. Most of our foot ankle injury cases tend to lack ankle plantar flexion or the ability to calf raise. What you want to think about is how important that movement is. That is how you propel when you take a step. So when you walk, when you run, when you jump, the push-off mentality is how you initiate from the foot, and that is your calf raise. So the nice thing is we can use calf raises both to clinically assess the ability to do that, but also to kind of gauge return to readiness, especially our post-operative cases. Anybody who's been in a boot for a while, what I can tell you pretty emphatically is the calf tends to shut down. So we see a lot of calf weakness evolve with post-op prolonged immobilization. So if you're in a cast or if you're in a boot for at least a few weeks and beyond, patients' calves will get a lot skinnier and their ability to actually lift their heels off the ground becomes very difficult to actually unable to. So we need to restore this push-off complex. So as a progression in weight bearing, oftentimes we can start with two-leg calf raises because the nice thing is both legs can help each other out. Let's say, for example, this is our injured side or our recovering side. With 50-50 weight, we're going to work on elevating and dropping back down, making sure that we maintain even weight on our injured or our recovering side. It is very easy to want to lean over and use the opposite side more as a crutch, but this gives you a chance to really work on both sides at the same time, knowing full well that the healthier side can act to help out. In some situations, if we want to control a little bit more elements of the foot, we can do a ball squeeze at the rear foot. So Daniela is going to hold the ball with her heels. The idea behind that is it keeps the rear foot more vertical so that the arch doesn't kind of collapse in on itself as we go up and down. For cases of patients who have pain, say in their instep, their midfoot, think of like a post-tib problem. Oftentimes when you push off, the ankle rolls inward. And so we want to control that by holding the ball as we go. That starts to educate the foot to not splay out as it goes up and down. So we can work towards a volume of 20 to 25 calf raises. Now we're building to that, so if we don't have that on day one, that's fine, but that is a metric that we look to go for because that's actually how we're going to test our single leg strength. So as we evolve out of two legs, we're going to take the same concept and now we're going to do a single leg calf raise for volume. Again, our ultimate goal is at least 20 to 25 repetitions. Honestly, most technically, you'd want to compare what your non-injured or your non-operative side can do first so that you can get that number. And then you're going to see how well your recovering side can match that. Things that we look for single leg calf raises in terms of compensation. We want to make sure the knee stays straight the whole time. If the knee starts to bend as we try to lift off, that's not your calf doing it, that's your leg doing it. So again, we want the knee to stay completely straight as it goes up and down. We also want to maintain that similar height. So if we notice that the person is lifting, but now they're not getting as high, we know that that calf is getting tired. So we want to promote full height, good technique, stopping at whatever that number is. As a continuing progression, right now we're coming from the floor, but we also want to work into that negative progression as well in terms of motion. So we can take any step or edge, have the ball of the foot kind of resting comfortably, dropping into a little bit more passive dorsiflexion or bend, and then coming up and back down. We can follow the same algorithm. Double legs can ultimately go to single leg. If we need to control the rear foot, we can also do the ball again if we wanted to. Again, our ultimate goal is to develop a really nice, strong push-off. And again, this will go a long way in helping our walk quality, our walk endurance, our power. It'll have a nice foundation to running and jumping as well. So when we think about the importance of calf strength and push-off as it pertains to the walking stride specifically, what you want to think about is when you take a step forward right there, that is the calf raise moment itself. So as we take our normal step forward, we are pushing off that back foot into our next step. Now start to think about how many steps that you take in a day. We take hundreds and thousands of steps a day. So that's a lot of calf raises. So as we're building up calf strength, you really want to start to think about the number differential there. We need to do volume-based raises to start to match the endurance of our walking volume in a typical day. And especially if we do any kind of walking for exercise or running for exercise, that's going to increase that number exponentially. So when you really think about it, we really got to build up a lot of volume here, ultimately to get someone to withstand even a typical day's worth of movement.